My name is Geraldine and I'm one of the co-founders of MAITS, which stands for Multi-Agency International Training and Support. And Esther, who will do most of the presentation, is our CEO. So just very introductory information. MAITS is an international charity and we provide free disability training for children, young people, adults with cerebral palsy, autism and a range of other developmental needs. Our aim is to improve health and education services by training people. So we train teachers, we train therapists, we train occupational therapists about how to support people, children and young people with disabilities. So that's our aim, and we then want to develop capacity and sustainability within those countries. So then the trainers go off and train other people to support. So far we've reached about 1 million people in 20 different countries. So I'll pass over to Esther, who will do the main presentation.
Okay, and just to say thank you very much to Geraldine. Geraldine was one of our first volunteers, our co-founder, and last year was the winner of one of 3 of the 6 Prime Minister's Point of Light Awards for her volunteering work, so thank you to Geraldine. And so what's the issue globally? Well, globally there are 1 billion people living with disabilities. The vast majority of these, about 80%, live in developing countries. And there's a real issue in terms of access to services and access to resources, and also cultural attitudes towards disability generally, which make it extra difficult. What does MAITS do? Well, the way that we try and tackle this is that we work with people that provide educational healthcare services and also with community members. So the project that you kindly funded in 2017 that started last year is our infant feeding project, which is basically a project that teaches low resource, low cost methods for helping babies who are struggling to feed because of a disability or because they were born prematurely. And with this project we've managed to reach 2,400 mothers and babies since last February, thanks to the funding that you gave, so thank you. And then other projects we offer, so we have a community health worker programme, which is a training programme for non-specialists on how to work with families with disabilities to help support them with the practical needs their children might have around feeding, positioning, building muscle strength and all kinds of things like that. And then this is a training course that I attended in Sri Lanka in just January in Colombo. And that's another one of our community health worker projects. We also have a parent guide and a child feeding programme as well. And then our 5th project is basically a small grants programme. Now, when I was in Sri Lanka, someone said to me, so how does this programme work? And I said, well, basically, people can request training from anywhere in the world in a developing country, and we can find them the trainers and we can bring them together, and then we help to fund that programme. So she said, it sounds a bit like Tinder for training. And I said, we haven't marketed it as that before, but yeah, there are similarities. So the issue that we need your help with today is we have had an increased demand for programmes rolling out specifically around master training programmes where we train the trainers. So for example, like the programme in Rwanda, where the 3 people that we trained have helped to roll out that programme to reach 2,400 people since last February. We couldn't have done that with just 2 trainers. We've had 7 requests for master training in 7 different countries, and we want to deliver 21 small Tinder for training small grants as well. So this lack of capacity that we have, to kind of give you an idea, we basically are running in these, last year it was 7 countries we worked in total, and we're doing that on a staff team of me full-time as CEO and 1 day per week of finance and HR support. We have 450 volunteers, 80 of whom are based in developing countries. And as you can see, that means there's quite limited capacity in terms of doing more and developing some of these train the trainer programs. We would like to also be able to develop multi-year programs that would enable us to apply to DFID and larger donors to be able to expand and have a transformational effect. So the solution that we've come up with is that to build our capacity, we'd like to employ a part-time person, a project coordinator to help us with this work. And they would be able to do some of the things like registering new volunteers and finding new organisations that want to receive training, etc. And this would free me up to do things like developing the multi-year programmes, having a master training programme developed fully, because we've got 7 that are waiting to find funding and things like that, and to be able to actually work on those fundraising applications as well, and diversify our funding sources basically. So this is the story briefly of Abdullah, who's from Colombo in Sri Lanka, and his mother Zulfi, and a local project director from the National Centre of Cerebral Palsy that we've worked with for a number of years. He took part in one of our training courses, and one of the key things is that our training isn't just classroom based, it's also about working directly with parents and children and showing people how to work with them in a practical way so that they can also benefit. His mother said to me that she was very grateful for the training that had been provided. She was very happy to be able to be part of training where she'd not only learnt things for her child, but she could see that other people would be able to be more equipped with the skills they needed to help support children like hers. So I shall leave the impact, she could ask us more questions about, and those are other bits of support that we're looking for as well.
Terrific.